I'm Dr. Ashish Jha, MD Internal Medicine and DM Gastroenterology and Hepatology. I'm working at Navatia Gateway Hospital in Siliguri. Hepatitis B and C is a disease caused by virus, hepatitis B and C, and on chronic illness after infection with hepatitis B and C, if somebody have the chronic illness, that on long term can lead to liver failure, cirrhosis, hepatocellular carcinoma, other complication of chronic liver disease like encephalopathy, altered sensorium, hematemesis like blood in vomitus, ascites means blood in peritoneal cavity, and coagulopathy, and that's because of bleeding tendency from your mouth or some gut. Now, how does it spreads? Hepatitis B and C usually spreads. It's a blood-borne disease, and hepatitis B and C common mode of transmissions are blood transfusions, previous history of surgery when a blood bank did not had facility to screen hepatitis B and C, and sexual transmission, and use of contaminated syringe, or so always use disposable syringe, and sometimes hepatitis B can be spread in family with family contacts, although it's rare, relatively with less prevalence. Hepatitis B and C is one of the most infectious virus. Why it's important to know about the hepatitis B and C? Because in hepatitis B and C infection in all over the globe, or particularly in India, is not a rare disease. In India comes in intermediate prevalence category of hepatitis B. So approximately 7% prevalence is of hepatitis B, and hepatitis C also having the approximately 1% of prevalence in common population, and higher in drug abusers, history of CRF patients, hemodialysis, thalassemic patients, the prevalence is a little higher. Because of long-term problem with liver, like because it can cause cirrhosis, hepatocellular carcinoma, other complication of CLD. So it's important to know about this so that we can prevent, we can detect at an early time, and we can prevent to damage one of the vital organ like liver. Basically, most of the time, patient may have symptom, may not have symptom. Sometimes comes with the advanced stage of liver failure or cirrhosis or cancer. So early detection of hepatitis B and C is essential, and for that awareness is important. Early detection, it is nowadays it's a simple test, at least a screening part is a very simple blood test, a single blood test we can detect the hepatitis B, C status in our blood. So it's a simple blood test. Result can be some kits are available, even in a few minutes we can get the results, in few minutes to few hours, and some ELISA test takes time in one day, or advanced labs maybe in the same day. So we can get blood screening if particularly it's recommended, particularly for high risk individuals, like somebody is having chronic renal disease on dialysis, thalassemia patients, IV drug abusers, or who is having sexually promiscuous behavior also. And if somebody is having family history of hepatitis B, that these patients should be screened with the blood test. Thank you.